Okay, let's take a look at this question right here. A nurse aide is assigned, let me cover up these answers. A nurse aide is assigned to a table in the dining room during the resident's lunch. One of the residents who is seated at the table begins to have a seizure. The nurse has been called. The next action by the nurse aide should be to A, guide the resident from the chair to the floor. B, remove the other residents away from the table. C, try to open the resident's mouth to check for food. Or D, keep the resident in the chair by holding around the resident's waist. The correct answer is A, guide the resident from the chair to the floor. Okay, why is it important to check the feet of a resident with diabetes at least once a day? Is it to A, to look for sores on the feet the resident may not feel? B, to check if vision problems have resulted in foot injuries? C, to trim the toenails so they do not become long or jagged? Or D, to make sure the resident does not get a foot fungus? Correct answer is A. Remember, a resident with diabetes may not feel sores on the feet. Okay, before helping a resident to stand who has been lying in bed, the nurse aide needs to A, find out what the resident plans to do for the day. B, make sure a walker is available for support in case it is needed. C, ask if the resident has taken any medication recently. Or D, allow time for the resident to adjust to sitting at the edge of the bed. The correct answer is D, allow time for the resident to adjust to sitting at the edge of the bed. Which of the following is generally experienced by a resident with low blood sugar? A, fever, B, weakness, C, sour breath, or D, frequent urination? The correct answer is B, weakness. When feeding a resident, the nurse aide notices that the resident keeps coughing after each drink of fluids. What is the appropriate response by the nurse aide? A, give the resident more time to swallow. B, keep the amount of fluid small by using a spoon to give fluids. C, add thickener to the fluid to see if it helps stop the coughing. Or D, stop the feeding and report the coughing to the charge nurse right away. The correct answer is D. Stop the feeding and report the coughing to the charge nurse right away. Okay, Abdul is a client who is being given oxygen therapy through a face mask. Which of the following is contraindicated for Abdul? A, engaging in talk with incoming visitors. B, using cotton bed sheets. C, consuming his own lunch. Or D, making use of an electric razor to shave. Which of these is not okay for a resident receiving oxygen therapy through a face mask? Correct answer is D, making use of an electric razor to shave. Next question. A patient with COPD was admitted to the first floor of a facility a few days ago. In a bid to assist this patient, the CNA can A, make a decision on the most suitable device to utilize, B, turn on the oxygen, C, ensure the connecting tubing is secure and has no kinks, or D, make a point of turning the oxygen on and off as necessary. The correct answer is C. Ensure the connecting tubing is secure and has no kinks. A CNA should monitor patients who need oxygen therapy so as to notice if they develop hypoxia. Some of the first signs of hypoxia are cyanosis, as well as an increase in the patient's pulse rate. B, being able to breathe well only when seated. C, increase in the patient's temperature, as well as decrease in respirations. Or D, the patient being restless, dizzy, and disoriented. And the correct answer is D, the patient being restless, dizzy, and disoriented. Instead of the word convulsion, one could use the word seizure. If a CNA is taking care of diabetic patients, there are some symptoms that should be reported immediately if observed. One of these symptoms is emesis. Emesis meaning vomiting. If a diabetic patient begins to vomit or throw up, this needs to be reported to the nurse immediately. You are a CNA working in a nursing facility, and a diabetic patient is assigned to you for care. This afternoon, you are preparing to demonstrate to the patient how best to take care of his feet. Which of the following is appropriate? A, avoid washing feet with mild soap. B, weekly cutting of toenails and removal of cuticles. C, soaking feet in hot water. D, applying lotion on the feet to moisturize them and prevent dryness while avoiding the spaces between toes. And the correct answer is D, applying lotion on the feet to moisturize them and prevent dryness while avoiding the spaces between toes. Okay. And it looks like we have 2 questions here. Let's take a look at our last one. The symptoms of hyperglycemia include, we have 4 choices. A, becoming irritable, rapid pulse, and excessive perspiration. B, gaining weight, rapid pulse, and feeling of tiredness. C, feeling thirsty, losing weight, and urinating frequently. Or D, losing weight, developing diarrhea, and abdominal pain. The correct answer, as you can see, is C. Hyperglycemia signs would be feeling thirsty, losing weight, and urinating frequently.